guys, thank you for visiting my channel, Medical Assistant with Miss K. If this is your first time visiting, welcome. My name is Kendra, aka Miss K. I've been a medical assistant since 2004 and a medical assistant instructor since 2011. So I wanted to answer a question that I got, and I have my phone here. So if you see me looking down, I'm looking down at my phone. But I got the question. It says, what advice would you give someone thinking about becoming a medical assistant? Now, I have had this channel for the last few years. I've probably talked about this multiple times, but I'm going to answer this question because somebody may come across this video who has not seen the other videos. But first of all, let me just say this. So medical assistant is an awesome career, especially if you want to work your way up to becoming like a nurse or even a provider. Many people use medical assisting as a stepping stone into other things. And then some people enter the field because they just want to work as a medical assistant, right? And so I think that it's important, though, to understand what you're really getting into and to really, just think about it first. So one of the first things I would say is to know exactly what a medical assistant does. So one thing I've noticed that some people use the term medical assistant interchangeably with nursing assistants. And it is two different careers, two different professions, two different scopes of practice. And I've done videos talking about the difference between the two, so I won't get into it here. But think about for medical assistant, think about that person, when you go to the doctor, the person who brings you to the back, gets you ready for the doctor. They're the ones checking your blood pressure and, maybe even doing your injections or drawing your blood, doing your EKG, right? Assisting the provider. That is what a medical assistant does. So vital signs, right? Medical assistants can give injections. Medical assistants they can draw blood, they can do EKGs, right? Medical assistants also, they work with urine samples. They can do swabs, right? They can do vision and hearing exams. So that's the first thing I would say. Just understand exactly what a medical assistant does. And if you choose to go to school for medical assistant, just know that you have to learn somewhere, right? So you and your classmates are going to be learning on each other. And that's one thing that I was surprised, that's one thing as an instructor that I was surprised about. I was surprised that people did not realize that. Like, they would come into the class and be like, we got to learn each other. I'm like, how else did you think you were going to learn? Yeah, some schools, they'll let you practice first on a fake arm when it comes to phlebotomy. But yeah, you guys are going to be working on each other, right? And so I do want you to also understand that. And some of the administrative things that medical assistants may do, scheduling appointments, right? Maybe even verifying insurance, maybe, checking patients in, checking patients out. Also maybe handling referrals and doing prior authorizations, okay? So there is, you got the clinical side, then you got the administrative side. So, you can become a clinical medical assistant and do both, right? The clinical and administrative duties of a medical assistant, or you may be someone who says, I want to be a medical assistant, but I don't really want to be hands-on. So in that case, you may think about becoming a medical administrative assistant where you're doing some of the administrative duties that I just mentioned. Another thing you want to do, you want to choose your school carefully, okay? Now, with the online resources that we have today, you can easily look up YouTube videos to see what people are saying about them. You can look up reviews and all of that. So I just recommend looking into the school, even calling to find out. And these are things that people don't know that they can ask. You can ask the school before you enroll. You can ask them their job placement rate, like how many students are actually getting jobs, like, how many students are actually passing certification, right? Getting their certification, their passing rate. You can ask these things, right? Make sure you find out how much it costs. What certification will you be obtaining? These are things that you want to ask. Is it hybrid, meaning will I be online for some of my class and then going in person? Would I be online for the lecture part and then going in class? How often do we go in person, right? These are questions you want to ask. If it's strictly online, how will I get my hands-on experience? Will I get an externship at the end? Do I get a day or two to go in person, to get my hands on? These are questions that you want to ask. You want to take your time and do some research. Now, and I know for some people, you may live in a place where there are not a lot of schools in your area. And this is when it's time to start looking into hybrid options and even online options. I know I said things in the past about the online schools. However, because times are changing, I have become more open to online schools only because of the change and the way things have changed, and also because of the fact that a lot of the online schools now, they are actually making a way for you to get your hands on experience. So that's my biggest thing. As long as you can get your hands on experience. Now, if it's just strictly online, they don't provide an externship, they don't provide any way for you to get your hands on experience, then no. But if it's online and you can get that externship at the end, or they're placing you, directly into a position, or you get a day or two of of clinicals, then that's fine with me. Another thing I would say is think about whether you are really a people person. Okay. When you're in healthcare, you will be working with people. You have to love people. You have to like people, right? You have to like helping people. You got to have some patience for people, right? You got to have compassion, right? You got to have empathy. You got to be able to put yourself in their shoes and understand that these people are sick. A lot of them are scared. They're nervous, especially depending on what specialty you're in. You need empathy in general, but you're going to just encounter so many different things depending on what specialty you're in if you do become a medical assistant. So it's just so important to really be real about yourself and ask yourself if you have that capacity to have patience. Do you have the capacity, to be empathetic, to be compassionate, to care for someone who may not be very pleasant because they're not feeling well or they're scared? You can be someone who have excellent clinical skills, right? You can be someone who catches on quickly. You're the best phlebotomist in your class. But if you have a bad attitude, that means nothing. If you're not teachable, even having a good attitude toward your instructors, and then when you get out into the field for your managers, like you have to be able to work with people, work on a team, because at the end of the day, the goal is always going to be quality patient care. So just be real with yourself. I had a student years ago tell me, Miss K, I don't like people. And I was like, you might want to reconsider then, because she was dead serious. She said, I don't like people. I said, well, you really want to reconsider becoming a medical assistant, because if you don't like people, this is not the field for you. Another thing I say is to be ready to multitask. One of the things that I made the mistake of doing was thinking that it was easier than it actually is. So not that it's really hard, but I will say this. So I used to see the medical assistants that would bring me back, and I just thought, oh, this is all they do. They just, they bring you back. If I need an injection, if I need a shot or something, they'll do that. My baby need an injection. Well, actually, at that point, I hadn't even had my baby yet. But if I need a shot or whatever, they'll do that. This is it. Not realizing that you're going to be doing other things. So you may be answering the phone while you're bringing patients back, right? You may have a patient in room 5 who needs injections, and then you got 2 patients in a waiting room that needs to be called back, and then you got a patient in room 7 who needs an EKG. It can get busy sometimes. I will be honest about that. It does get busy. So you got to be able to multitask, and don't make the mistake I did, when I was on the outside looking and thinking, oh, that's it. Now there are, of course, some specialties, some positions, and some jobs where you don't do as much. And then there are some positions where you are just swamped all day. I mean, from the moment you walk in to the moment you leave, it just depends. It's hard to say what type of experience you'll have, but just know you will be multitasking. So you're not just doing your clinical duties, you're doing some administrative as well, as I mentioned earlier, and sometimes you're doing them at the same time. I think I did mention at the beginning of this video that some people use medical assistant as a stepping stone. So, that's one thing to think about too, is to know, why you want to become a medical assistant. Like, what's your reason? Are you getting into it to just work as a medical assistant, or do you want to work your way up to nursing? As a medical assistant, you can work your way up. Even as a medical assistant, you can become a lead medical assistant, a supervisor. You can become an office manager, right? You can further your education. You can get a degree and become a healthcare administrator, right? There's different things you can do. You can do like I do. Like I teach medical assistant. I'm a medical assistant, but I'm also an entrepreneur. I'm an author. I sell courses. I help people with their credit, and budgeting. And so I'm not just in the medical field. I've actually branched out and I do other things. I just wanted to just offer that, just to let you know that even as a medical assistant, you can work as a medical assistant and stay in this field, and this is your career, and do other things. Or you can just, like I said, work your way up to nursing, administrator. You can get into other things in in the field. You can get into the administrative side, billing and coding. You can become a phlebotomist and EKG tech. You can stock your credentials that way. There's the possibilities are endless. So again, my advice to you is to, really try to figure out if this is right for you. Think about whether you have the capacity or not, right? Do your research on your schools and make sure you understand what you would truly be getting into if you became a medical assistant. So do me a favor and check in below in the comments. Let me know where you are. Are you someone who's thinking about becoming a medical assistant? Are you already in school? Let me know where you are. Also, if you have any video suggestions or questions, you can feel free to leave those as well. For those of you who may be watching this, you are already in school and you need a resource to prepare for certification. My MA refresher course is an online study guide, and I have video lessons, quizzes, practice questions in there. I have over 400 practice questions in the refresher course. So I will link that below. It's also for people who maybe have been out of school for a while and you just need a refresher. So if you happen to watch this and maybe you went to school a long time ago and you're wondering if you need to start all over again to get certified, not necessarily. You can take my MA refresher course and you can take the CCMA exam or any other exam that you may qualify for. But I mentioned that one because that's the one that most people end up taking because it's the easiest to obtain when you've been out of school for a while. So just something for you guys there in the comment section. Also, I'll leave it in the description. I think that's it. If I think of anything else, I'll come back. I'm talking off the top of my head. So every time I do that, I leave something out. But thank you guys again for visiting my channel. Make sure you like the video if you haven't already, especially if you found it helpful, and hit that subscribe button if you haven't already. And shout out to my members on the channel as well. Thank you again. Be blessed.